All right, you guys, yeah, so you guys already know where to find me. Obviously, thank you for coming. I do appreciate it. I already kind of took the time before we got started here to let you guys know. I've been doing this for 12 years now. Linda mentioned that when she met me, I was single. Now, family man up there. But you can find me in all these places. I'm online, pretty active on social media and stuff like that. If you have any friends, family, neighbors that have questions on this stuff, or the home and auto stuff as well, I'm happy to help them out. So, who do we help? We help people that are turning 65, people that are older than 65, or anyone that's maybe losing insurance. A lot of times people are working past 65 and they're retiring, coming off their employer coverage. So I meet a lot of people in that situation. People that may be unhappy with their current plan, that happens sometimes too. Or people that are on Social Security disability that may be actually younger than 65, but if you have Social Security disability for 2 years, you are able to get Medicare A and B. So what is Medicare? Medicare is, of course, the U.S. government's largest insurance program serving more than 66 million people. It's a federal health insurance program for U.S. citizens and legal residents. And it's individual health insurance. As you know, it's not a family plan, but individual. And it's not Medicaid. Medicare, Medicaid often, got a phone call coming in. We're going to miss it. So who can get Medicare? People that are within 3 months of turning 65, people that month that they're, even if they're still working. People that are younger than 65 with a qualifying disability, if they're on Social Security disability, or if they have end-stage renal disease or ALS, commonly known as Lou Gehrig's disease. These stats here are one of the reasons why I started doing this, about 12 years ago, and I'm still doing it. There's 10,000 people that turn 65 every day. So there's plenty of baby boomers out there that still need our help, that are getting onto Medicare. About half of those people are enrolled in a Medicare Advantage plan. I think that's shifted a little bit. Well, I don't think I know that has shifted a little bit over the past several years, where you used to have more of a share of the Medicare supplement. Some more people have gravitated towards and moved towards the Medicare Advantage plans. So, what does Original Medicare cover? Original Medicare Part A is your inpatient hospital stay. So that's your hospital room and board, the meals at the hospital, your operating room services. It also covers you for your skilled nursing care after the hospital. It also covers hospice care. Medicare Part B is going to cover your doctor's appointments, specialist appointments, outpatient care, mental health, clinical lab services, and durable medical equipment, as well as ambulance rides and occupational therapy. So here's your breakdown cost-wise for 2025. You have Medicare Part A. Most people will pay zero premium for Part A. As long as you've worked at least 10 years and paid your taxes, or your spouse has done that, there's no Part A premium. There is a Part A deductible. The Part A deductible is $1,676. That is for each inpatient hospital stay. Okay, you've never paid that because you have a Medicare supplement. Yes, yeah. So, I always go over Original Medicare first. Original Medicare, again, that's that red, white, and blue card. You're getting that directly from the federal government. Right. The reason you have not paid that deductible is because the Medicare supplement is filling in that gap. So instead of you paying that deductible, the plan picks that up. That's what you pay the premium for.
So, but there's both A and B, the premium is income based.
Yes, there's another slide on that in a few.
Yeah, I just saw the asterisk there.
Yeah.
Like zero, I know.
Yeah. Okay. So,
Other costs,
if you're in the hospital longer than that 60-day benefit period, $419 for days 61 through 90, and $838 for days 90 and after, or after 90 days, rather. Right. Your Part B insurance, you see the asterisk here. For a lot of people, it's $185, but that is income based. Right. I have another slide next that'll show what the rates are. Your deductible, that is the same for everyone. Your annual deductible for Part B is $257.
And that's this year.
Yep, that's for this year.
That changes every year.
Yep, that changes every year. We were talking about before, as you folks are walking in, they give us these numbers. They will change slightly every year. So this last year was 240, okay? Now this year, maybe it's 260. Maybe it has gone down sometimes, but it'll probably be like 273 or whatever it is. This has always stayed the same, 20% of your Part B services. So 20% of that doctor's visit, surgery, ambulance ride, that has stayed the same. Here is your IRMA, your income-related monthly adjustment amounts. So this is the amounts that you would be looking at if you're making over a certain amount, and you have different brackets there for individuals and married filing jointly. And that changes every year a little bit too. So what's not covered by Original Medicare? So Original Medicare does not cover prescription drugs, okay? You have a separate prescription drug plan, or you could have a prescription drug plan that's part of a Medicare Advantage plan, but those are not being covered by Original Medicare. Doesn't cover you for any dental, vision, or hearing coverage. So that again would be a separate standalone dental, vision, hearing type plan, which we do offer, or those benefits a lot of times will come with Medicare Advantage plan. Hearing aids, eyeglasses, contacts, long-term care. So people often ask about long-term care. Usually by the time I'm meeting with someone, it's super expensive for them to get a long-term care policy. They are, I think, becoming more popular as people live longer, but it's something usually people may explore in like their 50s if that's a concern for them. Because Medicare is only going to cover you for up to 100 days at a skilled nursing facility. Anything after that, you'd be on your own. So, how do I get coverage? So we talked about the gaps in Medicare, that hospital deductible, the 20% coinsurance. There's two different ways you could mitigate, lower, or eliminate those costs. You have a Medicare supplement option or a Medicare Advantage plan. Medicare, in their endless effort to be confusing, there's a couple different terms used. You may have heard Medicare supplement or Medigap policy, same thing. It's supplementing your Medicare, or it's filling in the gaps, right? A lot of times people will refer to it as their secondary insurance because Medicare is their primary insurance. If you have a Medicare supplement, you would have a standalone prescription drug plan. So you'd have a drug plan that is just specifically for the drug coverage. Or you could do a Medicare Advantage plan, more of a pay-as-you-go option. So with a Medicare Advantage plan, that is your primary insurance. That's coming from a insurance company. That is a kind of a co-op between Medicare and the insurance carrier, because Medicare Advantage plans are getting supplements from the government, okay? Those Medicare Advantage plans combine the benefits of Medicare A and B, and also combine Part D, the drug portion. So a lot of times Medicare Advantage is referred to as Part C of Medicare. Okay, so Medicare supplement plans, a couple things to know about them. There's 10 different plans. Each has their own letter. They didn't get too creative with the plan names. You've heard, Plan F, Plan G, Plan N. There's several other plans. These are standardized by the government. So what that means is if you have Plan G with one carrier and your neighbor has Plan G with a different carrier, you have the exact same benefits.
Coverage.
Benefit for benefit, the coverage is the same. The only difference is the price that you pay for it.
Yeah.
So that's what I do as an agent. We have conversations with people. If they've had their plan for a while, you are able to change your Medicare supplement any time of year. Usually, when I'm putting someone with a carrier, we work with 30 different carriers. I probably write the same 3 or 4 often, and then every once in a while here or there. But those carriers have, stable rate increases. Each carrier is going to give you a rate increase, but usually it's about 3 to 5% year over year.
Is that based on age or?
Yes, it's based on age. Some carriers will do a community rating, which is based on a few other things along with the age, but for the most part, that's based on you just getting a year older. With a Medicare supplement plan, there is no drug coverage, dental, vision, or hearing that would have to come from a separate plan. there's no medical underwriting those first up to 6 months after enrolling in Medicare Part B. So if you're new to Medicare, there's no medical underwriting, and the plan's guaranteed renewable. So I always kind of stress that with people is when you're turning 65, I know no one here is in that situation, but when someone's turning 65, I usually advise them, you may want to go with the Medigap plan initially, and you can always change it to a Medicare Advantage plan if the premium exceeds what your monthly budget allows. Because once you have that plan, it's yours as long as you keep paying the premium. And you have coverage nationwide. There's no network provider. So a lot of people like that about Medicare supplements. There's no network. You can go see any doctor you like that takes Medicare, and that's 99% of doctors. Stu, can you do me a huge favor? Can you do one more sweep out there just in case? Because I spoke to the couple that was supposed to be coming. Medicare supplement plans. This is the exact same chart that you'll see in the Medicare and You guidebook, that big thick book that they send out every year that no one wants to read. Basically is the reason I have this job, because no one wants to read that book. It's boring and it's just too much information. So I always say this presentation is basically that book just condensed down into a presentation. This chart here is all the different Medicare supplement plans. Medicare Advantage plans. Medicare Advantage plans work a little bit differently than Medicare supplement plans do, right? They will combine the benefits of Medicare A, B, and D, and that will be in the form of an HMO, a PPO most commonly, or private fee-for-service plans, Medicare medical savings account, or special needs plan. Typically, especially in this area, most of those plans are PPOs, which stands for Preferred Provider Organization. What that means is there is a network of doctors, but you are able to go outside of network. You just have to pay a little bit more. Usually it's a 30% co-insurance for that. So the benefits of Medicare A and B are still in place, but these plans offered by the private insurance carriers most often include prescription coverage. 90% of the people that I meet with will have a MAPD plan or Medicare Advantage prescription drug plan that includes the drug coverage. The only situation where people will not have that plan is if they have like VA benefits, or if they maybe have some type of benefit through a former employer or a union where they're getting their prescriptions covered. So they just take the medical option. But for the most part, people will do the Medicare Advantage prescription drug plan. These plans will have typically a $0 premium. So that's what sticks out the most. That's what kind of grabs people's attention. If people are calling or you're seeing commercials that are trying to switch your coverage, that's the thing that they bring up first, because obviously that's a big difference. Instead of paying $150 to $200 a month for a Medicare supplement, you're paying $0 for the Medicare Advantage plan. You will have out-of-pocket expenses as the year goes, and you run into doctor's appointments, MRI, X-rays, CT scans, hip replacement, whatever. Hope no one has any of that stuff. But as you run into those things, you have co-payments for those services. When you have a Medicare supplement, that's picked up by the Medicare supplement. When you have the Advantage plan, you're not paying that monthly premium, but you'll have to pay, $250 for your surgery and $350 per day in the hospital for that first week. So that's kind of your trade-off. And I think I have a few slides that kind of go further into it, but it really just comes down to a matter of preference, what your monthly budget is, what your health is, what you're most comfortable with. Sometimes you'll need a referral to see a specialist, not often, but that is a possibility, and you will have a network of doctors. The plans, again, we work with, there's so many different Advantage plans in our area. There used to be just a handful, and now there's tons, and each carrier offers several different plans. But I often write kind of the same handful of plans each year because I'm confident in their network, that their network is strong. I look at the doctor's in the network. So for prescription drug plans, this again is going to be coming from a private insurance carrier. These plans cover most common medications. and some vaccines that aren't covered by Part B. Every prescription drug plan, just like a Medicare Advantage plan, has to be approved by Medicare. They have to meet a certain standard, and they all have a drug list. So they have a formulary, which is just a big, thick book of prescriptions that they cover. And with a prescription drug plan, you'll pay a monthly premium. That premium ranges depending on what plan you have. There's plans that start as low as $2.50 a month, and there's plans that go over $100 a month. Just depends on what prescriptions you're taking. When we do the drug plan, I go to Medicare.gov, I put in your list of prescriptions. It gives me a list of all the different drug plans that are available to you based on that drug list, from the most cost efficient on down the line. So if someone's just taking lisinopril and simvastatin, they can probably kind of get a basic drug plan that's going to cover your generics, and it'll still cover the most common prescriptions out there. You might have to pay more for those higher tiered brand drugs. Whereas a plan that's $100 a month, it's that expensive because maybe it has a lower deductible or no deductible, and it might have some drugs cheaper. A lot of times what I run into, or my clients run into, is they're taking a tier 3 or 4 brand prescription, and that drug's just kind of expensive. There's not really a way around that. Some of the things that I bring up with people are things like New Jersey PAD. PAAD stands for Pharmaceutical Aid for Aged and Disabled. That's a program that'll help you pay for prescriptions that isn't income-based. And then things like samples from the doctor and so forth. Anything outside of that, you're on your own, but I know people get them from like Canada and stuff like that. So this IRMA applies to Part D as well. So your monthly premium could be affected by your income for the prescription drug plan as well. The prescription drug plan has stages. So most plans have an annual deductible. There is a maximum of a $590 deductible for 2025. Some plans have a lower deductible. Like I said, it has a lower deductible. Could be more expensive on the premium. That's kind of your trade-off. For many of these plans, you don't have to pay into that deductible if you just have generic prescriptions that you're taking. Once you hit that $590, you're in your initial coverage phase. The insured, that's you, is going to pay 25% coinsurance for all covered prescriptions up to $2,000 total drug cost for 2025. Your copay most often is lower unless it's a brand drug, but a lot of times if it's a tier 1 and 2 drug, maybe it's $5 to $7 copayment. Once you hit that $2,000, you then go to catastrophic coverage. So that cost goes down to zero, and you will not pay anything. And the cost is covered by a combination of the plan and Medicare and the drug manufacturer. So that's good. That is actually a newer feature. It used to have to hit a higher amount to go to that catastrophic coverage, but this year that was changed to get it to 2,000. Your formulary, I kind of touched on that. Every drug plan has a tier formulary. Tier 1 and 2 are generics, preferred brand for tier 3, and then tier 4 is brand, tier 5 specialty drug. Okay, so what should you choose? So this is the conversation that I have with a lot of people every year, whether they're my client and maybe they have a Medicare supplement, they're looking to lower their premium, or they're considering making a change because they're concerned about some health issues that could be coming up and they want to be cautious. There's no right or wrong decision, basically. But just to kind of review what these two different options offer, and remember, you can't have both. You have one or the other. Right. With a Medigap and a prescription drug plan, everything original Medicare covers. The Medigap, average cost of that's going to be about $200 a month. That's going to vary depending on what plan you have, how old you are, and then you would have a drug plan with that. When you have a Medigap plan, you have very little out-of-pocket expenses. So you're not going and getting nickeled and dimed for, you know, your x-rays and your surgeries and things like that. You have more of a choice of going to see doctor wherever you'd like, whoever you'd like, whether it's somewhere over here, over in Philadelphia, you could fly to California and see a doctor, doesn't matter. You know what you're gonna spend each month. So it's more expensive, but you know, hey, $175 for my plan G, I pay that. I have my annual Part B deductible, which is $257. That's it. That's all you're paying. You could go and get all the bones in your body replaced. That's what you're paying. You know. So with a Medicare Advantage plan, you typically have a $0 premium, and then you have those copays. Now, if you go to the doctor, get your annual wellness visit done, and that's it, and you ran a marathon that year, you're good. You're the winner, you know? So that is always, you know, something that can happen. I write about 50-50. You know, when I do a presentation, I don't skew it towards one way or the other. Basically, I just like to lay it all out and say, okay, these are your options. And it usually comes down to just preference, and it's about 50-50, depending on what people are feeling. Your max out of pocket for a lot of these Advantage plans is about $9,000, you know, which is a lot of money, but it is a cap to kind of avoid any complete catastrophic costs, you know, if you have a really rough year. What I always tell people is this, I mean, it depends on what level of risk you take, you know, just like you have compared to something like auto insurance, you can maybe knock your premium down a little bit if you increase your deductible. It's not gonna really affect it that much, to be honest, but you know, the more risk you're putting on yourself, the lower your premium is gonna be with insurance, right? The more risk you're transferring over to the insurance company, the higher your premium is going to be. You never know what's coming down the road. You know, once you get into your 70s, your 80s, you never know what's going to happen next. People that are super healthy, especially people that I meet at 65, they haven't been in the hospital since the day they've been born, and I can totally understand going with the Advantage plan, thinking, okay, well, even if I do run into a hospital stay, maybe that's going to cost me $1,500, but I've got an emergency amount, you know, for that. What I always tell people is, hey, the money that you would be paying for the supplement, if you don't already do this, just take that aside and, you know, save it for an emergency. That's what I would personally do. With the Advantage plan, you're going to have a little bit more restriction with the network of doctors, and, you know, just be aware that you're going to have co-payments. Usually doing this 12 going on 13 years, people that do the Medicare supplement option, I don't really hear from them that much. You know, I get them set up with the plan, I check in with them when I can around the time to review their drug plan. You know, Merry Christmas, Happy New Year, we'll see you next year. Maybe if their rate has climbed, we can shop that plan a little bit and move them to something else. The Advantage plan I get more phone calls on. Right. So, because people going for a colonoscopy and, oh, they found a polyp, so now this is going to cost me X amount of dollars, or, you know, there's more movement on those plans. There's a lot of options. There's different payment amounts for different procedures. Sometimes things are categorized as surgery that you thought was maybe going to cost less. There's just more questions that come up. But at the same time, I have plenty of people that are more than happy with their Advantage plan and say, you know, hey, I saved the money and, you know, I haven't really thought about it. So we kind of just touched on this. It's a personal decision based on, you know, how your health is and what your budget is. There are certain plans called special needs plans. Depends on the availability of those in the area. These aren't offered everywhere, but there are certain plans based on chronic conditions that are available sometimes. And then financial assistance. Medicaid, you know, you can have Medicare and Medicaid. That's something called dual eligible. There's specific plans for people that are in that situation. There's something called extra help. It's a low income subsidy to reduce medication costs, to reduce Part B costs. Those things always go, directly through Medicare, Medicaid, New Jersey Family Care for New Jersey. So I don't really handle that. People that are in that situation, if they have Medicare and Medicaid, I would just go over the dual eligible plans with them. Everyone here is already enrolled in Medicare, but it's 3 months before, the month of, and 3 months after you turn 65. Working, again, everyone, this doesn't really apply to anyone here. Changing your plan. Okay, so this is an important slide. Switching plans. There's all these different rules and enrollment periods and everything. So this slide breaks that down for you really nice. So the annual enrollment period, that's what we all hear all the time. That date range October 15th to December 7th. That is when you can make any change you'd like. So if you have a Medicare Advantage plan, you can go to another Medicare Advantage plan. You can go Medicare Supplement to Advantage plan, Advantage plan to Supplement. You can change your drug plan. That is when you're allowed to switch. That's when I'm the most busy because all the carriers put out a lot of information. It is that time to shop around. So that is, just like tax season for an accountant, that's when I'm touching base with everyone, making sure, I'm there if people have questions and they need to switch a plan. With that being said, you don't have to make a change every year. I actually prefer that you don't. Because then we'll have to go through it, fill out another application. I'm kidding, of course, but you do not have to make a change every year. Some years there's more disruption than others. So there's been years doing this where everything pretty much stays status quo. All the carriers leave everything the same, and the plans don't change that much as far as the Advantage plans go. The drug plans don't change that much. So everyone just kind of stays where they're at, and I switch a few people that maybe I met through referrals or whatever. Other years, there'll be a lot of disruption. I feel like the last several years there's been more. Kind of feel like the carriers almost like that. They're constantly trying to get more members. They want to keep their members, but they want to bring in more people onto their plan. So these carriers, Cigna, Aetna, AmeriHealth, Humana, United Healthcare, they will, do their typical marketing every year. Usually their plans are adjusted a little bit to make them a little bit better. And, oh no, you're late. Detention.
Okay.
Hi, how you doing?
You deserve it.
That's okay. I'm teasing. Thanks. I'm glad you guys were able to make it.
It's important.
Yeah. Thanks for coming out. Yeah, go ahead, take a seat there, wherever.
Up here.
Let's start over.
So yeah, I'm gonna start now. So yeah, that's the time of year you can make a change. Now, there is another enrollment period that a lot of people aren't aware of because there's actually certain rules about marketing this enrollment period. But from January 1st to March 31st, you're allowed to make a switch from one Advantage plan to another. You are not allowed to change your drug plan. You're not allowed to drop your Advantage plan and go to, you can drop your Advantage plan, but you can't go from an Advantage plan to a prescription drug plan. So that in the beginning of the year is a little less busy, but if you made a change that you're not happy with, you can go back to the other Advantage plan that you had or a different one during that time. There's also special enrollment periods. So these are situations where people are losing coverage. If someone has moved, they just moved here from Florida, that's a special enrollment period. If they qualify for state financial assistance, that's a special enrollment period. Sometimes they give people enrollment periods. If there's a severe thunderstorm in New Jersey and that was during an enrollment period, they'll say, hey, if you were unable to switch your coverage because of this natural disaster, then you are granted a special election period. So those things do happen. Most commonly, it's the moving, it's someone who's coming off of employer coverage. So if they're losing their work coverage, that's a special enrollment period. So there are opportunities to change throughout the year if one of those situations presents itself. This doesn't apply to anyone here, but a lot of questions I have around people that are turning 65 and they're still working are around the late enrollment penalties. If you're late enrolling to Medicare A, B, or D, you can face a penalty. Part A is a 10% penalty, Part B is a 10% penalty, and Part D is 1% of the current average premium for each month if more than 63 days without creditable coverage. So that doesn't apply to anyone here, so I don't have to get super into the weeds on it. But I often have that question when people are coming off work coverage. You have to have what Medicare deems creditable coverage, meaning you have coverage through an employer that has more than 20 employees. That counts as creditable coverage, so you can defer the Part B until you retire in that situation. Okay, so I ran through that pretty quickly. This is actually a new presentation that we had, so thank you for allowing me to practice on you guys a little bit. But you know, it's a lot of information. That's why we have, you know, the presentation today. Is it helps to brush up on this stuff and just know what your rights and entitlements are. You know, you do have the opportunity to change your plan. If it's a Medicare supplement, you can change throughout the year. Medicare Advantage during that enrollment period. Right now, no one with the Advantage plan can make any changes until October, and then that plan takes effect in January. But it was really nice to get in front of you folks, and you know, also for you guys that came in late, we are doing lunch afterwards right across the hall. Order anything you'd like, and it's on me. But I'll take questions if anyone has questions. Yes, sir.
We switched from United Healthcare, as you know, because you're our agent.
Yes. Yeah.
United Healthcare to Cigna, because United Healthcare pushed the premium up to $49 a month,
Mm-hmm.
and Cigna was $34 a month. So that was one thing.
Yeah.
The other thing was Cigna gave $2,500 for dental,
Uh-huh.
and also didn't ask any questions. You could spend it on anything at the dentist.
Mm-hmm.
And the other company was $1,500. Not deductible, $1,500 benefit, and you had to get just 2 cleanings and things like that.
Mm-hmm.
But you had a standard $1,500, and it was more rigorously structured.
Mm-hmm.
What I didn't like, I guess the drug plan wasn't too much. Well, I take that back. There were a lot of things I didn't know about the Cigna. Like we had a $500 deductible.
Mm-hmm.
I don't know if that was also in United Healthcare's Medicare Advantage. I don't remember there being a $500 deductible. I didn't know about, or at least I didn't remember. The other thing is when you go for like an X-ray or an MRI or something like that,
Mm-hmm.
you get hit with a big charge, like
Mhm.
$40, $125. If someone in your household's getting an infusion, you get hit for $925. I wanted to know, you know, what would I have been protected on had I had stayed with United Healthcare?
It's a good question. There are probably close to 40 different Medicare Advantage plans. Each carrier, you know, I always name kind of the same handful: United Healthcare, Humana, Cigna, AmeriHealth, Clover. They all offer multiple different plan options. When we go to these meetings with the different carriers, you know, they pump up their plans and they'll say, well, we want to make sure we offer people options depending on their situation. Some plans are, you know, they offer more dental and they're geared towards someone that might, you know, really want that dental coverage and so forth. From one carrier to the next, it's hard to say exactly, you know, down to the dollar what the difference would have been. I feel that you can rest assured that your experience probably wouldn't have been a whole lot different, you know, because I know we reviewed it and you went with that. I always like to get feedback from people. That was like another reason why I wanted to do these, a few of them during the summer is, you know, hearing from clients how they liked the plan or didn't like the plan, because that'll shape what plans I'm recommending this year. You know what I mean? So Cigna, that plan that they offered, I think what made it attractive was the dental coverage. I think a lot of times it's tough because you have a lot of different options, right? What I try to do is gather what's most important to you and then say, okay, if that's important, you know, this plan checks X, Y, and Z box. But just like if you're looking for a house or a car or something, it's tough to be like, okay, this one's cheap, it gives me this, it gives me that, it gives me this. Usually if you're getting something better in one category, they're kind of taking something away somewhere else. And it's kind of just like, I hate to say pick your poison because that sounds negative, but like, you know, go with what's most important to you and, you know, you see what happens. And what's good is you do have the opportunity to change every year. You know, with that being said, whether you have a plan with Aetna or Cigna or United Healthcare, the plans are very similar. You know, the carriers or any agent that's trying to switch the coverage is going to tell you, oh, you haven't heard of this, the super duper plan, you know what I mean? And they're going to tell you X, Y, and Z about the plan, highlight what is great about the plan, and kind of poo-poo the other plan. You know, you guys have been my clients for a long time. So I would just say the best thing you can do is, you know, you guys are here today. We'll talk again in the fall and just, you know, review it, you know, as thoroughly as possible. You know, I feel that in the fall, I wish sometimes our window was a little bit bigger. Like they just made it October 1st through the end of the year. So there wasn't such of a mad rush of people to, you know, get to. Because my book of business has grown and I can't take 2 hours with something, you know what I mean? But I appreciate the feedback, and I guess my long-winded answer is, I don't think the total money out of pocket for you wouldn't have been all that different if you stayed with your plan, went with your current one, or did a different one. You know, at the end of the day, you want to make sure that, you know, you have something, and you probably paid $500 more for deductible, but then maybe had that over with the dental. So that's basically my explanation for that. Yes.
I had Cigna this year, which
Okay.
I've never had before.
Okay.
And my experience is that there are places that don't take it.
Okay.
Larchmont Imaging now changed over South Jersey Radiology.
Mm-hmm.
Aetna was always taken by them.
Okay.
And also Patient First, which
Mhm.
is like the walk-in center Patient
Okay.
First. They don't take it either.
Okay.
So I'm gonna switch back to Aetna next year, just knowing that those are two places that I would prefer to go to.
Sure.
So I don't know if anyone else has had that experience, but I found that upsetting because I'm like, what do you mean I can't go there? I went there 8 months ago
Mhm.
when I broke my hand, and now I can't come.
Yeah. So I did switch a good handful of people to a Cigna plan because I had a lot of Aetna people where their plan was discontinued. So, you know, we take a look at the plans and have to move people somewhere. But yeah, I mean, network is a good thing to consider. So yeah, we can definitely move it back to Aetna. I think a lot of times my clients and myself, you look at, okay, what's the premium? And,
The premium
you know,
was the same. I
right.
paid zero premium.
You know, Aetna has some plans that maybe it's $30, $40 a month for the plan, but the network's maybe a little bit stronger. So, yes.
The comment I wanted to make is that I'm a healthcare provider, I actually still work, and the thing is that